Alison Princic. I'm a naturopath and an Atlas Prof. I became an Atlas Prof in 2007. My professional background is in chiropractic therapies and also naturopathic medicine with postgraduate studies in mostly naturopathy. Currently working in Wollongong, which is in the Sydney region, in my own practice. I had my friend and colleague Terry Murfitt ring me and say, "Ali, we have to do this," and so we did. Well, I knew the importance of the Atlas in physiological and anatomical terms, so I was aware of the fact that the Atlas was the #1 fundamental reason why we had so many physical maladies. So when I realised that there was a way that we could actually correct that with a non-invasive and extremely successful procedure, then there was absolutely no question that I wasn't going to train in it. My own experience was that my own maladies of every kind, from different sports injuries and things like that, were all cleared up entirely. It was as if I had no pain, no suffering. Mental and emotional health was at an absolute high, and it was the best thing I ever did. Did a lot of sports and had a few little traumas too. I would say that my balance improved out of sight, my timing and different things. I love to surf, and so I found that my timing with surfing and also with strength training improved out of sight. The most surprising thing was that so many people had amazing results. So many people. It was very, very rare that somebody didn't have an extreme breakthrough with their physical health, their mental health, their emotional health. I found it to be probably the most outstanding therapy, and I was extremely happy that I trained in it because I could help people to that level. I've had people say that this particular modality has been life-changing for them. The treatment, when it was applied to them, was enough to stop migraines for 30 years, pain for chronic pain, acute pain, people with strange gaits, pigeon-toed, structural disorders all through the body, organ disorders, neurological disorders, emotional disorders of different kinds. So many people have had incredible breakthroughs. Yeah. I'd recommend it to absolutely everybody. I think that it's such a fundamental correction that it really should be done to every person. Children, suddenly their posture is improved out of sight. They report learning improvements, they report improved behaviour, and the parents particularly report that they become far more intelligent in their way of living. They choose better foods, they become more switched on with their sport, with their schoolwork, everything improves.
Sure.
I do have a lot of sporting clients, and they have, especially the professional people, they've felt that the Atlas was exactly what they were looking for, because they would have a lot of physio, which they found to be very helpful. They would have osteo corrections, chiropractic corrections, remedial massage, but the one thing that seemed to make all of those modalities far more effective was in fact having this very, very, very sound correction done. And so after the Atlasprofilax, every single other modality seems to be that much more effective. I would have to say that anybody who has it done won't be sorry that they did. Their posture will improve, their life will improve, their quality of life will improve physically, mentally and emotionally. Depending on where they're at, even if they're in very good health, they will still experience really, really, good breakthroughs. Oh, absolutely. Absolutely. Everybody tells their friends. It's word of mouth. That's how the practice operates mostly, except for people that have word of mouth from another area of the world. We often get people calling and saying, look, my auntie from Sweden or Finland or Norway or Croatia said you have to have this done, and they come. They come because of the fact that someone has said you have to have this correction. It's imperative. And particularly if they are symptomatic in a certain way with headaches or migraines or back pain, neck pain, leg pain, central pain, whatever the case might be, they seem to be the most prevalent patients that we have, although some people come for all kinds of different reasons.